Hello, I'm Dr. Raman. In this video, I will go through how we carried out a qualitative study to explore the patients' and surgeons' perceptions and experiences of brachial plexus injury surgery in Cambodia. Brachial plexus injury is a devastating injury which causes severe physical limitations and psychosocial problems. They usually affect young men between the ages of 15 and 30 years. I'm sure many of you have heard of the rule of 770s. That is, 70% of these injuries are caused by motor vehicle accidents, of which 70% are from motorcycle accidents. 70% of them present with multiple injuries, of which 70% are supraclavicular lesions, of which 70% have at least one of the nerve roots avulsed, of which 70% involve C7, C8, and T1, and 70% ends up suffering from chronic pain. This was a qualitative study based on thematic analysis. It was carried out at the Children's Surgical Center in Phnom Penh, Cambodia. The two patients were purposefully selected, and the interview was video recorded with their informed consent. I have listed here the inclusion criteria of the patients selected. These two patients were interviewed by a single interviewer in Khmer, which is the national language of Cambodia, and this was subsequently translated into English. The next two slides show you the demographics of the two patients selected for the interview. This slide shows you the types of surgery they underwent and their 3-year follow-up. This slide describes how the thematic analysis of the patient's interview was undertaken. So the video interview of the two patients was transcribed verbatim. The transcription was read many times, and the verbatim responses were analyzed line by line. The video was repeatedly watched as well, paying attention to their speech, their body language, their arm movements, and their facial expressions. This transcription was double-checked against the video recording to ensure that they were true to data. The analysis was done following the principles of thematic analysis, and during the initial coding phase, two of the authors analyzed the data independently, and the codes were then discussed, following which they were then assigned into categories. The process was repeated to determine that there was consensus, and the categories were subsequently grouped into themes. The next two slides will demonstrate to you how we present the data. You can see here that I have tabulated the data into 4 columns. The first column is the raw data of the illustrations, the second column is the code, third column is the categories, and the last is the theme. So in the first column, which is the illustrations, it is the word-for-word verbatim responses from the interviews. It is important, as I've said, that as you read the transcriptions and watch the videos, for you to assign the words and phrases to into groups or codes which share the same characteristics. And you have to do this repeatedly until all the data has been coded, following which you can then assign them to a wider umbrella, which is a category, and then ultimately you assign them to a particular theme. So this is usually done by at least 2 reviewers independently, and the results will be discussed to reach a consensus, but if not, a third reviewer will be invited to preside the differences. So this is like keeping files in a drawer of a cabinet. So the codes will be your files, the categories would be the drawers, and the theme would be the cabinet. So there are many ways of doing this, and sometimes you may find that the same codes can be in more than one category. So this is almost like having a mixed box of chocolates where you can arrange them into milk, dark or white chocolate, or you can categorize them into plain, nutty, or those with sweet filling. So from the patient's interviews, there were 6 categories which have been organized into 5 themes. You can see that the return of movements in the paralyzed limbs was important, as it gives the patients the satisfaction of the potential of returning to some form of normalcy, which would allow them to participate in life, and being employed is part of their recovery. So from this study you can see how the patients have both reflected on what the surgeons have said to them and only understood what was truly said when they experienced the delay in their recovery. It has shown how important pre-surgery counseling is because it forms a major part of the planning, as the patient satisfaction with regards to the final outcome of their surgery is very dependent on how their expectations have been dealt with. For the surgeons' perceptions and experiences, the 2 surgeons were requested to first watch the video interview of the 2 patients with English translation. They were then interviewed independently using a semi-structured interview guide. They were requested to answer 3 questions. First is, what is your impression and impact of the patient-reported outcome measured in the video? What is your experience of developing the Brachial Plexus injury service in Cambodia? And how has your experience in Cambodia affected your Brachial Plexus injury practice? The next 4 slides will show you how we have presented the data for the surgeon's perceptions and experiences of the BPI surgery. The interview recordings with the surgeons were transcribed verbatim, similar to what we did for the patient's interviews. The 2 reviewers read the transcriptions and watched the videos repeatedly. And as I said before, it is important that whilst reading the transcription and watching the videos, you need to try and assign the words and phrases into codes with similar characteristics. So you can see here the 4 columns. The first is the raw data or the illustrations, the second is the code, the third is the category, and the last one is the theme. So for example, in the first column here, surgeon 1 said that the first impression was the satisfaction. So I've coded this as patient satisfaction. And he also said that expectations were generally managed quite well by the pre-operative counseling. So this has been coded as managing patients' expectations. So these 2 codes have then been categorized into a wider umbrella in patients' recorded satisfaction with their functional recovery, and then assigned to a theme which is capturing patients' overall perceptions of the BPI surgery. The theme developing the BPI service in Cambodia is based on what the surgeons have said. So from the raw data here, you can see that Surgeon 1 expressed that to develop the BPI service, they needed to understand the needs of the community. So this has now been coded as the needs analysis of the community. He also said that it was possible to bring the surgical skills and transfer these skills over to the local surgeons. So I've coded this as transfer of skills. So you can see here that the 2 codes have been categorized under how the environment dictates the services needed and grouped into this particular theme. So you can see here that there are 3 codes. The first code is identifying interested surgeons. This is based on Surgeon 1 saying that they found a core group of surgeons who were committed and dedicated to learn the skills. The second quote was workshops and hands-on training, and this is from him saying that they conducted a series of workshops to train the local surgeons in basic microsurgery and did hands-on training in the operating theatre. The third quote was overall impact of the project. So from their experience, they devised the training program to enable the local surgeons to be able to do the BPI surgery. And also based on Surgeon 2 saying that the whole BPI service development has brought hope to a hopeless situation. So these three quotes have now been categorized under a robust training program to train local surgeons to perform BPI reconstructive surgery and assigned to the theme BPI training program in Cambodia. In this slide, Surgeon 1 wondered whether it was worth the effort to continue doing brachial plexus reconstruction as the results were not very satisfactory. This has been coded as the value of doing BPI surgery. He also believed that a qualitative approach should be undertaken to understand the patient's expectations and concerns following a major injury or disease. And this has been coded as other lessons learned from the BPI experience in Cambodia. Similarly, Surgeon 2 also expressed the importance of clinical skills because in Cambodia it is difficult to get an MRI scan or nerve conduction studies. So these two quotes have been categorized as the impact of the experience in Cambodia on their own practice and assigned to the meaningfulness of work. Here you can see the theme is a change is needed for the future, and this is based on what Surgeon 1 said, where a qualitative patient-reported outcome measure is what is needed for the future of measuring outcomes in healthcare, and this has been coded as a subjective evaluation of the participants' reported outcomes and categorized as qualitative study for measuring outcomes in healthcare. So in this study, the two surgeons who volunteered their time to an underdeveloped country, the meaningfulness of their work is very important. And they have learned from their experience that health, illness, and medical intervention cannot always be measured, and it is important for them to understand what they mean to the patients themselves. So for the treating surgeon, the success of the surgery must be measured not just by the degree of motor and sensory recovery, but also in its long-term biopsychosocial and economic impact. It is important for the researchers to understand that the patient's evaluation of success may completely differ from the surgeon's assessment. This study has shown the importance of communication and providing adequate preoperative education and counseling to the patients undergoing brachial plexus injury surgery. The issue of being employed and returning to normalcy to participate in life and what it does to a person's self-esteem cannot be overemphasized. Qualitative studies allow for the subjective evaluation of the patient's perceptions, experiences, and expectations, and this can be incorporated into the management strategies to inform clinical practice and improve patient experience. So further research using qualitative methods should be conducted following severe traumatic injuries to study the biopsychosocial impact of the injuries on their lives, and it is important to include the surgeons or the healthcare professionals' experiences in the care of these devastating injuries. I hope that this has helped demonstrate how we've carried out the qualitative study on brachial plexus injury surgery by interviewing the two patients and the surgeons, And here are the articles that you can look up later in your own time if you're interested. So thank you for listening.